Hello and welcome to Fantasy Therapy. I'm Dr. Jordan Soper, a board-certified behavioral and cognitive psychologist and an ASEC-certified sex therapist. On the couch today, we have Katniss Everdeen, who is going to teach us a little bit about her experience in the arena and out, and I'm going to talk to her a little bit about post-traumatic stress disorder. So Katniss, we've already gone over your informed consent documentation. We've already done an intake. Today is our treatment planning appointment. And what I first want to start together is going a little bit over your history in a smidge more detail. Are you okay with that?
Yes, I think that would save time.
Great. So I want to go over what we call an index trauma. Now, an index trauma is an experience that someone identifies as their worst trauma, the one that bothers them the most. Sometimes it's their first, sometimes it's the most violent. Even though I know there's quite a significant trauma history of all of the experiences, both in and out of the arena, do any of them stand out to you as more traumatic than the others? So Katniss, has anyone ever walked you through what is post-traumatic stress disorder or PTSD?
No.
Do you mind if I walk you through it a little bit?
Okay.
So anytime we're talking about PTSD, which at its very core is a trauma-related condition, we're looking at about 5 different criteria sets. Now, you were just able beautifully to identify what your index trauma is. That is criterion A. That is when a person experiences a traumatic event that leads to the development of the rest of these criteria. Criterion B is what we call the re-experiencing symptoms. These are memories that pop into your head unwantedly. These are flashbacks. These are nightmares. Does any of that sound familiar at all? Yep, those are re-experiencing symptoms. So then criteria C is the avoidance. Avoidance comes in 2 forms, internal and external. Internal avoidance is trying really, really hard to push down the memories, the thoughts, the feelings about the traumatic event. And then external avoidance is doing everything in your power not to be around people, places, things, sights, sounds, smells, anything that reminds you of the traumatic event. Do you notice yourself engaging in any avoidance symptoms?
Real memories of you.
That still doesn't mean I'm going in there.
He's strapped down. He can't hurt you.
No, this is different.
Where are we gonna run away?
Into the woods, like we always talked about. If we leave right now, we're gonna be far away from here by tonight. No. No, we can't do this. Katniss, don't make me do this!
Those are perfect. Yep, those are exactly what that criterion C is all about. Then we have criterion D. Criterion D's got a big old name to it, but it's called negative shift in mood and cognition. And what that essentially means is that after going through a traumatic event, the way that you think and feel about yourself and other people really starts to change and shift into a more negative way. Feelings of guilt, shame, blame, beliefs that the world is unsafe, the world is dangerous, people are going to hurt you. Any of that sound awfully familiar?
The only thing that I can think about every day, every waking moment since the reaping is how afraid I am. There's no room for anything else. I am. That's why I killed Cato. And he killed Thresh. And Thresh killed Clove. It just goes around and around.
The next criterion set is something called the hyperarousal symptoms. Now, oftentimes when people hear arousal, they think sexual. This is more like your body can't calm the heck down. So constantly feeling like you're on edge, having what is called an exaggerated startle response, being a little bit more irritable or angry, as well as having difficulty sleeping. Now, the sleeping is different in this criteria compared to criterion B with re-experiencing symptoms, but inside the hyperarousal more, it's like difficulty falling asleep, staying asleep because your body can't calm down. Do you notice yourself experiencing any of those hyperarousal symptoms?
Peter was left behind.
Yep, those are exactly it. Now, while going through a traumatic event doesn't mean a person is necessarily going to develop PTSD, but when we have a person who goes through those traumatic events and then subsequently has those symptoms, all of those together, that's actually what makes up PTSD, which, given everything that you've walked me through, it really sounds like this explains quite a bit of what's been going on for quite some time ever since you got out of the arena and out of District 13. Does that sound about right for you?
Yes, I think so.
Would you be interested in learning a little bit more about how we treat PTSD?
Yes.
Okay, well, let's get it started. One of the things I absolutely adore about Katniss Everdeen, especially as an example of what is PTSD, is she really highlights the multiple traumatic events this person went through, and then being able to look at how certain traumatic events bother her a little bit more. So even though Katniss experienced what we would call childhood trauma exposure, having scarcity in food, resource access, but then she also lost her dad, so a traumatic grief experience. You notice that her hyperarousal symptoms, you notice that her re-experiencing symptoms are more latched onto what initially happens in the arena, especially in that scene when she kills the career tribute. You see her having way more re-experiencing symptoms in response to that. That's not uncommon for people who've experienced traumatic events where certain experiences or certain memories are going to bother them more. That's the thing about doing trauma-informed care. It's not about what we think is the worst trauma, it's what they think is the worst trauma, because their worst trauma is the one that is bothering them most in our life, which may be different if we even went through that exact same traumatic experience. So Katniss Everdeen is a beautiful example of what post-traumatic stress disorder actually can look like in an individual at any different stage in her life. I would have loved to work with her, particularly once she was out of the arena, out of District 13, and in a safe location, particularly that later section of Mockingjay where she's back in District 12 with Peeta and is more stable. We don't do trauma-informed care with patients when they are actively still in a zone that they can be traumatized in. Not safe and stable enough to do the really difficult trauma-informed care. So who would you like to see next on Fantasy Therapy? Who do you really want to see on the couch? Comment down below on who you would like me to therapize next, and don't forget to like and subscribe to this channel. And remember, may the odds be ever in your favor.